Then apply a very gentle, not even a traction, more of a simple, gentle pull. Then bring the arms over the head. And you're going to check to see which thumb is shorter. And you can see that her left thumb is shorter, which indicates a short left psoas. So then I like to ask the client to bend their elbows, and I like to show them so they can see that their left thumb is shorter. Okay? So let's discuss, what if your client has shoulder problems and can't bring their arms up over their head? Well, this test, you can simply ask them to bring their arms across like this, and you're still going to go through the same protocol where you check to see that the heels are on the heel of the hand is on the same plane. The reason I like to bring the arms over the head is just so we get a little traction or a pull on them. You may wonder, how is it that a short thumb indicates a shortened iliopsoas? Well, think about the attachment at T12. So if the attachment there is restricted, shortened in some way, it creates a downward pull and also causes a slight contralateral rotation of the torso, resulting in what appears to be a short thumb. You always want to work the short side first. Always work both sides of the iliopsoas, but you'll find one side needs more attention than the other. But you want to start with the side that's short. So this next maneuver is a positional release technique for the short iliopsoas. So it was Tracy's left side, so we'll do it on her left iliopsoas. The way that this works is that we place the muscle in a shortened state and hold it for about 2 minutes. And this calms down the muscle spindles, which rule the stretch reflex, which in a lock short muscle, they're going to have a very high signaling or a high spindle bias. The first part of this technique is we want to shorten the muscle from both ends. So you're going to side bend the upper body from the thoracic spine. So I reach under and get her thoracic spine, and we'll just do a small side bend. And that's part one of this technique. Okay, the second part of this technique is to shorten it from the lower end. So I'm going to slightly abduct her leg, externally rotate, flex the thigh. Now my hands are on the femur, and they are compressing the femur in towards the acetabulum. So I'm not doing any kind of soft tissue work on the quadriceps or anything like that. This is all about a gentle compression into the acetabulum. And you hold this for about 2 minutes. And then once you've done this for 2 minutes, so it's always nice to retest for the short psoas and see if there's been some improvement. So this is a shot of the test for a short psoas after we've done the positional release, and you can see that there's been a lot of improvement just after that short 2 minutes. So it is a valuable technique to do before you go into your deep tissue work on the iliopsoas.